Welcome to The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. Today, and by the way, I'm your host, Vanessa Emerson. I got too excited there, founder of Dental Speakers Bureau, and I'm excited to introduce to you Dr. Paul Caselle. So welcome to The Buzz, Paul.
Well, thanks for having me.
I'm glad you're here. Now, Paul trains dental professionals around the country in implementing and maximizing the use of lasers in their practice. And today we're going to be discussing his course, Laser Dentistry, The Future is Now. Paul, I'd like to start by asking you, what would be happening in the lives of your target audience attendee that would draw them to this course? What's the problem that this course can resolve for them?
Well, I found many years ago, I would have patients come into my office and I'd be recommending certain soft tissue procedures. And naturally, I'd refer them out to a specialist. And the question I would get from patients would be, well, doc, why can't you do it? And so I was looking for a solution, a way I can comfortably treat these soft tissue procedures for patients without the normal swelling, bleeding, and postoperative pain. And my research led me to lasers and laser dentistry.
Ah, I see. And so in this course, you show then probably other general practitioners how they can incorporate this in their practice. Can you give us more detail around what you cover in this course specifically?
Well, we cover a lot of routine soft tissue procedures, such as fibroma removal, frenectomy, which is very important. That prevents patients from having these gaps between their teeth and can prevent recession. We also talked about crown lengthening, which is a common procedure for general dentists to do, as well as restorative. When you have an all-tissue laser, you can use restorative and treat multiple teeth in multiple areas without the need for local anesthetic. So it's a very valuable tool for the general dentist and specialist for that matter.
Ah, good point. Is it typically a dentist then that would attend, or who would the primary audience be?
The primary audience here would be the dentist or a periodontist or oral surgeon. I know oral surgeons that use lasers in their practice, and they find it very beneficial for the reasons I stated.
Do you encourage the clinical team to attend as well with the dentist?
Yes, the clinical team can also benefit because we all know when the dentist leaves the room, the patients like to talk to the clinical team.
Yes.
Should I do this? What's involved? Will I have pain? Will I have swelling? So the clinical team can help patients realize the benefits and help them see that, yes, you can do this and it will be comfortable.
Excellent. So the format on this course, I see in your information that it's typically up to half a day. Would you classify this as more of like an intro course for the dentist who's considering adding this as a practice builder, and this would be a way to give them more information and on what, and then they leave knowing where they need to go to continue to build?
Exactly. This is an introduction to lasers because dentists know about lasers, but they don't really fully appreciate all the benefits that lasers can have for your patients and also for your business. For example, you're doing procedures that you currently had been referring out, now you could do it within your office. And patients are more receptive if they know you're doing the procedure. They're more likely to have it done because they have trust in your ability, and they really enjoy having it done in a place they know well.
Sure, that makes a lot of sense. Well, sounds like an important course. Sounds like it's very well-rounded. Paul, is there anything that would be important for the event planner to know about this course that we haven't already discussed?
Well, I think the important thing for the event planner to know is that it's a course that really isn't out there very much. You might see a laser course in some conferences, but not a lot of conferences. And sometimes it's not really thought of being important, but we see lasers coming into medicine and dentistry more so now than ever before. So having a way to do minimally invasive dentistry is so incredibly important because that's what people really want and actually need.
Well, there you have it. For more information on Dr. Paul Caselle's courses, you can visit dentalspeakersbureau.com, where you can find out more about this course and his others as well as his contact information. We'd be happy to help connect you and be able to talk with Dr. Caselle about how you can bring this course to your next event. So in the meantime, we will see you in our next version or issue of The Buzz. And thanks so much for tuning in. And thank you, Paul, so much for being here with us today.
Thank you so much.
Take care.